Well, my name is Ryan Brewer, and this is my wife Ashley. And this is Case, and we're here in the day in life of Case, Cornelius John Brewer. He's born February 28th, 2008, this year, and at about 2 months of age, he came down with pneumonia, and so we took him in, and they got him fixed up. And he came home with us, and we started to notice at about 2.5 months of age that his legs weren't really moving, they weren't developing in the normal fashion like our daughters had. On Ashley's birthday, July 28th of 2008, we found out that he had SMA, and life's been changed ever since.
SMA stands for spinal muscular atrophy. It is a degenerative muscle weakness disease. It affects all of the muscles, not only like motor functions like arms and legs, but it affects the respiratory muscles as well. The goal is to be proactive instead of reactive. We want to stop these things before they happen. We want to keep him from getting pneumonia instead of waiting until he's in the hospital with pneumonia and then saying, oh shoot, what do we do now? So everything that we have here, our goal is to keep Case healthy and out of the hospital. We do therapy with Case every 4 hours. So everything that you're going to see on this tape, it's not just a thing that we do one time a day. We are doing it every 4 hours. The first thing that we do is he gets albuterol nebulizer treatment, and we do chest percussion therapy, which is the little blue rubber thing that we just pound on all the different lobes of his lungs with, and that's just to loosen any secretions that he might have in his lungs. With SMA, you can't, it's a muscle weakness disease, so he can't cough as hard or as strong as other people can, so this just is the first step to helping get anything that might be in his lungs out. And we do that, you're supposed to do it for 2 minutes on every spot, and then it usually takes about 15 to 20 minutes total. And after that we do
the cough assist, and that is the brutal machine that basically forces air down and then pulls air out to help him cough up any secretions that he has anywhere in his lungs or in his throat, because his muscles are not strong enough to cough anything up. And so that's the machine. And it goes through 4 rotations of 5 breaths each. And then of course we suction the nose out and the mouth out as well once that is all over with.
Case has to use what's called a BiPAP at night. It kind of helps him breathe. It doesn't necessarily breathe for him, but it delivers pressure in and then pressure out as well, so it helps him inhale and exhale. He has his pulse ox connected to his toe at night, and that tells us what his blood oxygen level is. Cornelius is not allowed to eat normal food anymore. We're not allowed to give him anything orally, so this little tube right here, it's called an NJ tube, it feeds the food directly to his intestine. It bypasses the stomach and puts his food directly in his intestine. And the reason for that is because with SMA, kids tend to have very bad reflux, and Cornelius does have reflux. So the food goes into the intestine so that he can't spit it up, because then the danger there would be that he would inhale it back down into his lungs, and then that would put us back in the hospital again.